Are you suffering from a cold or is it allergies? Just ahead on Being Well, Dr. Bernie Ranchero from Sarah Bush Lincoln Health System will be here to talk about allergies and the best way to deal with the side effects of this sometimes pesky ailment. That's coming up, so don't go away. Well, today we've got Dr. Bernie Ranchero to talk to us about allergies. Let's first start by telling us what actually is an allergy. What's happening in your body when you're allergic to something?
Sure. An allergy is a substance. Usually it's a harmless substance that your body just has an abnormal reaction to, a hypersensitivity reaction. I liken it to if you're in your house and say you see an insect there, a mosquito or something like that, you could let it be. It's going to be harmless, won't do anything. But in someone who's very allergic to things, has a hypersensitivity reaction, instead of just swatting that mosquito or letting that fly be, they take a shotgun and they kill that mosquito or bug. But in doing that, they're causing more damage and more harm to the house.
Okay, so I know you get this question a lot. You know, do I have a cold? Do I have an infection? Do I have allergies? How do you know the difference between those?
Sure. The symptoms between colds and allergies can be very, very similar. A sore throat, itchy eyes, runny nose. Sometimes people don't breathe as well. Maybe they think, oh, I get these hives and these rashes. One of the things, though, is that, for instance, if you have a fever, usually you don't have a fever with allergies. Something also that's important is what elicited that reaction. If you know that you were around someone sick, or that you know you ate a certain food and that caused you to have an itchy throat, or if it's the time of year that causes you to have an itchy throat or scratchy eyes, well, then most likely it's an allergy. Versus, you know what, I have just out of the blue, I was around someone sick, or my immune system was down and I have a fever, that most likely could be a cold, a viral infection.
Do you have patients that say, I need an antibiotic for what I have?
Sure, all the time. They come in and they say, I have sinusitis, I have strep throat, I have bacterial conjunctivitis, an infection in the eyes. How can you tell the difference sometimes? Interestingly enough, sometimes people need to realize allergies can lead. You can be more predisposed to a bacterial infection or a viral infection. So sometimes when a person comes in with allergy symptoms, it can cross over into a bacterial infection or viral infection, and then it's appropriate to give medicine at that time. Otherwise, when it comes to allergies and viral infections, you just need to let it play out. You need to do what we call supportive care. Plenty of hydration, rest, Tylenol, ibuprofen is needed.
So you had talked a little bit about that taking some over-the-counter medications before the symptoms get really bad is actually really helpful. Can you explain what people should do?
I think sometimes people think that if I get allergy symptoms, I'm just going to pop a pill and everything will be better. We do know that the over-counter allergy medications, loratadine, cetirizine, those are your generic Claritins, Allegras, Zyrtex, things like that. If you take those work really well in preventing the symptoms. They're over-the-counter, non-sedating antihistamines. So you're blocking the histamine reaction. It's the histamine in your body and those immune cells that when they get exposed to an allergen, that they release that histamine that causes all those symptoms, the itchiness, the swelling, the redness, the secretions. So by taking it beforehand, you're going to prevent those cells from releasing the histamine. Where if you take it when you have the symptoms, then you're going to have the symptoms. You're just preventing future at that time from it getting worse.
So if you know in about maybe early spring when all the pollen comes out, you know that time of year is coming. Take it a week or so before, or how?
I would say at least 10 to 14 days before. And the reason is that you want to build up those levels in your system. And sometimes I know, we're not always the best at taking something every day. And so getting those levels built up in your system, if you know that in the springtime or that it's in the fall, or maybe it's throughout the whole year, even the summer. Some people have indoor, some people have outdoor allergies. So realizing that if I can prevent these things, then it's going to be much easier than when I have the symptoms.
Are there any adverse effects, side effects from taking too much of an over-the-counter allergy medication that we should be aware of?
Sure. Even though most of these medications are marketed as non-sedating antihistamines, sometimes they can be very sedating, some more than others. Zyrtec is usually a little bit more sedating than others, and I tell my patients, take it at night then, so that you can sleep. We all know that if we take some Benadryl sometimes, that can be very sedating.
Yeah.
And some people actually use that to sleep. So Tylenol PM actually has acetaminophen, which is Tylenol, and Benadryl, diphenhydramine, as a sleep agent.
Okay. Well, let's talk about what are some of the most common things that people are allergic to?
Well, there's several common things. First of all, when we think of allergies, we think of foods. And that's very important. Food allergies, because those can be deadly. I myself, when I was growing up, suffered from peanut allergies. And it was interesting because since I was young and skin tested and I was allergic to peanuts, we never had peanuts in the house. And I went to the University of Illinois, and when I was a freshman, I went to a Chinese restaurant that had peanut butter in the egg roll, and the egg roll was fried in peanuts.
Oh, no.
So I took a bite of that egg roll, and my throat started closing up, and I started wheezing. And being a smart college freshman, I got on my scooter, went to the clinic, and I said, I'm having a bad allergic reaction. And they gave me epinephrine and gave me some antihistamines, and obviously I did well with that. But as you know, some people can die from eating foods or getting stung by an insect or things like that. But 20% of Americans suffer from many types of allergies. The most common ones are pollen, animal hair, dust mites, insect bites, mold, food, latex, medicines, perfumes, and another one is cockroaches. So there's
Really?
Yes.
Never heard of an allergy to cockroaches.
And that's why they say, sometimes homes that have a higher cockroach burden, sometimes it's the droppings that the cockroaches leave behind that people are very allergic to.
So it seems to me you had a peanut allergy. I can remember growing up and thinking in school there was one kid that was allergic to milk.
Yes.
Now it seems like a lot of kids are allergic to, severe allergic reactions to peanuts. Why do you think we have more food allergies today than we did maybe 20, 30 years ago?
To be honest with you, no one really knows. There's some theories out there, and the theory goes that maybe our society has become too hygienic, too clean. When we were younger, or when society was more rural, or especially why do we see rates of kids who grew up in the city have higher rates of asthma and allergies versus the kids that grew up in the farm? And so the theory goes that we weren't, as infants and young children, were not exposed to a lot of the common allergies that are out there, and because of that, our immune system, when it encounters a unique allergen or irritant or something that should be harmless, it says, whoa, what is this? Maybe this is something bad. Maybe this is a parasite. Maybe this is something, a bacteria, a virus. So we need to mount an immune response to this substance and get it out of our system, and then you get an allergic reaction.
Okay. Can you develop, well, I know the answer to this question. You can develop allergies later in life.
Correct.
Because I used to have seasonal allergies, and now why do we develop them later in life?
And it comes back to anything we can develop an allergy to. Oftentimes, and this is why we need to be careful with cosmetics, is if you apply something to the skin, what happens is in our immune system, cells will look at that substance and say, is this foreign? Is this harmful? Is this harmless? And if it decides that something is harmful, then it'll develop a memory towards that substance. So maybe the first time you don't react, maybe the second time you don't react, but that third time, your body will say, hey, this is an invader, this is a bad substance, this is an allergen, an irritant, and then it will attack it and act like it's something that does not need to be there, and then we could have rashes, hives, swelling, wheezing, diarrhea, things like that.
Do you find can people outgrow allergies? Or if you, like for you, you were allergic to peanuts as a kid, I'm assuming you're still allergic. can you outgrow some of those allergies?
You actually can outgrow some of those allergies. And it's, some people can outgrow, for instance, milk allergies as they get older, later in life, when they're a teenager. But it's not uncommon also not to outgrow those allergies. And that actually, it has to do with desensitization. That sometimes the more you're exposed to something, your sensitization can go down. However, the opposite also holds true. The more you're exposed to something, your sensitization can go up. But that's how allergy shots work. So allergy shots work on the premise that can we slowly desensitize your immune system to this substance? So we give you a small portion of it in a shot, and then eventually over time we give you larger portions of that compound, of that allergen, to the hopes that eventually your body will just get used to it and tolerate it.
Okay. What do you tell parents who bring maybe their infants in who think, oh, my child has an allergy to this? What are some of the steps that physicians go through to help determine what children may be allergic to?
Well, one of the best things you can do in really preventing allergies is breastfeeding your child.
Okay.
Because you're giving that infant your own, helping them out with your own antibodies, your own immunity, and that way, if they come across something, they will have their own antibodies and their own immunity from the mother as well. So breastfeeding is a good one, and the other thing is watching out. If for instance, knowing your medical history. We do know that allergies there's a large genetic component to it. So if you have a child and you know you're allergic to certain substances, well, I would really make sure, maybe not in that first year, you don't expose that baby, that infant, to those substances.
Okay.
And that when you do introduce it, you're very careful and you do it in small amounts. And you make sure that, if you have a severe allergic reaction to something, then I would definitely probably avoid that in your children. Doesn't mean they're going to be allergic to it, but just be aware the first time that's introduced into their diet.
In children, can maybe an allergic reaction be mistaken for something else?
Correct. I think I see this all the time in the doctor's office when I ask, or I should say when my nurse asks, are you allergic to any medications? And they say, oh, I can't take erythromycin, I can't take this certain type of antibiotic, I can't take penicillins, I can't take, and really a lot of people are getting allergies and side effects mixed up.
Okay.
So for instance, if you take so let's say you take amoxicillin and a patient says, oh, I can't take that because my stomach gets upset. Well, that's actually more of a side effect.
Right.
Or if they say, oh, I get diarrhea, or something like that, I get a headache. That's not really an allergy, that's a side effect.
Okay.
An allergy would be something like a rash. Your lips, your tongue, your throat swells up, you have difficulty breathing. Those are more considered serious allergies and allergic reaction.
More respiratory.
Respiratory, skin.
Physical symptoms.
Correct.
Okay.
Right. And not necessarily that if I take this medicine, eventually the headache goes away. Eventually, if I take this medicine with food, I do better with it. Things like that.
Okay. Do you still do like skin tests for allergies for different things? We can
do skin tests, but we also, which is I think is more convenient, we offer skin tests, by the way, are the most sensitive way to test for allergies, but we can offer blood tests where we can actually do different panels and say we can find out what a patient is actually allergic to, different pollens, foods, because we can test for those antibodies.
Okay, let's talk a little bit about skin allergies.
Sure.
When we get, if you get into some poison ivy, is that a reaction to that, or are you allergic to poison ivy?
It's more what we call a contact dermatitis. That means on your skin you're having a reaction to the toxins in those plants, whether it's poison ivy, poison oak, different plants. Your skin is actually having a physical reaction to it. And the way we treat it is very similar to allergies. Once you get into those toxic plants, sometimes you're going to actually, if you're really allergic to that toxic plant, it'll actually look more like a burn.
Okay.
And people can get blisters and vesicles, and sometimes the skin will come off.
Wow.
But we treat it the same way with allergies. We can treat it with steroids, which are anti-inflammatories. We treat it with creams, with pills you can take, shots, and then of course we like to give medicine that can help stop the itching.
Okay. Are you finding that there's certain populations of people that are more allergy prone than others, or different cultures, or are you finding that?
Sure. Interestingly enough, genetics do play a role. Sometimes we're finding that African Americans are more sensitive to certain compounds and foods and things like that versus Asians, versus Caucasians, versus Europeans. So genetics do play a significant role. But what we're also finding is that as we become more global and I guess more heterogeneous in our genetics, that's crossing over now. So we are seeing allergies in countries and in races that we hadn't seen before. So it is growing. And like I said earlier, 20% of our population in the United States has some sort of allergy. Okay. So it's significant. Once you find what that allergen is, it's avoiding it. That's the number one thing you can do. A common question that I get asked is, especially if someone has indoor allergy symptoms, is do they have pets? You know, and sometimes it's the level of exposure that you have. Does the cat sleep in the bedroom? Does the dog sleep in the bedroom or in the bed? And sometimes it's keeping the pet out of the bedroom, keeping the pet outside, or making sure you have filters in the house, a HEPA filter for your furnace, a HEPA filter for the vacuum, a HEPA filter in your bedroom, so that you can get rid of the allergens in the air. So sometimes it's changing your environment. If you can't necessarily change your environment, then minimize those things that are causing you to become exposed to those allergens.
I've heard even people who have like a lot of dust allergies of taking up carpet in their home and going with a hard surface floor can actually help.
Yes, and these are all things you can do. If someone, dust mite allergies, we're actually not allergic to the dust mite themselves, but dust mites, they feed off our skin, and so it's the droppings of the dust mites that we're very allergic to when we inhale them. So some of the things you can do is you can encase your mattress in some impermeable plastic, and nowadays it doesn't have to be that vinyl feel. It can be a more breathable type high density fabric so that dust mites can't get through to the mattress, encasing your pillows. Again, the HEPA filters, or just if you're allergic to, if you have a lot of outdoor allergies, then I always tell patients, use the air conditioner. Keep your windows closed. Wash your hair before you go to bed. Wash your clothes before you go to bed at night, because a lot of times, if we don't realize it, we've been out there in the environment and our hair is full of pollen and other allergens. And so if we go to bed without taking a bath or washing our hair, then we're rolling around sleeping in it, and that can aggravate our allergies.
Yeah, I've noticed that particularly in the last couple of years, I can't sleep with the windows open anymore because I wake up stuffy, and that has to be from pollen and whatever coming through the windows at night. So it's nice to sleep with the windows open, but if you're miserable the next day, it's not worth it. So what other kinds of things can we do to help with seasonal allergies? Do you know, as a physician, you know, if it's a really dry, that what effect does weather have? If it's a really dry year, are allergens worse or better?
It also could depend on the different type of allergies you do have. For instance, this past year, the summer, there was some drought, then we had some late onset rains. This past year, in the state of Illinois, we had some of the highest mold spore counts ever. Okay. Normal mold spore counts, high mold spore counts are 50,000. We had over 120,000 on some days recorded. Wow. And then you add on top of that, people, the farmers started harvesting the pollen, the dust,
that
the
gets
crops
churned up in that.
Exactly. Yeah. And then when the farmers are telling me that they've never seen such mold on their crops, and then when they cut them down and harvest them, the mold's just in the air. And that can be very irritating to many patients, their lungs, their nose, their mouth, their eyes, and so the symptoms of the itchy throat, and then maybe their voice goes away, and then the secretions. What happens is our body, when it comes in contact with these allergens, it tries to get rid of them or wash them out. How does it do that? It secretes
runny nose,
runny nose, more secretions in the lungs and the throat, tearing in the eyes, things like that.
This is kind of a gross question, but let's talk about secretions in the nose. I have heard that you can judge by the color of your snot. We'll just,
Sure.
That if it's a certain color, if it's clear, can that help you determine if it's bacterial or viral or allergies?
Sure.
Okay.
Most of the time, generally, if someone has a clear discharge from their nose, the type you'd see, you know, when you're, if you've been around a 1-year-old that is teething, you see those clear secretions coming out, copious secretions coming out from the nose, that mucus. Clear, that's usually a sign of much more allergies.
Okay.
Now, if you have a more purulent discharge, a discharge that's more pus-like, that's real thick, has an odor to it, or green, brown, that probably is a sign that it could be infectious or viral. However, that said, you know, if you're out in the field harvesting and you have a brown discharge, well, that's most likely from the dust you've been breathing in.
Yeah.
You know, or if you've been, I'm sure, some of us experienced, if we travel to big cities or places where there's a lot of pollution, you could just wipe your face and you see the grime on your skin.
Yeah.
Well, if you're breathing that in, guess what? When you blow your nose, you're going to see that in your nose, you're going to see that in your secretions.
Okay. So in these last few minutes, just give us a few tips on allergies and what we can do to sort of get through this next allergy season, particularly if you have outdoor allergies, because that seems to be something that is going to happen here regardless.
Sure. If you're the individual that has, first of all, your family history, if you know that your mom and dad, your brothers and sisters, your first-degree relatives, those people closest to you, blood relatives, have a history of allergies, whether it be food or outdoor, well, then you're at higher risk for developing allergies. So avoiding those foods or those things that cause allergies. If you know that smoke bothers your allergies, then making sure you're not around people that smoke. If you can't, you know, some people are allergic to the pollen in the air, to the trees, to the grasses, to the crops. And then if you can't avoid those things of having a HEPA filter in the house, closing your windows, running the air conditioner, the pet's not in the bedroom, then it could be a matter of getting an over-the-counter remedy.
Okay.
But not overdosing on that. Some people think that, oh, if one works, maybe two will be better, three will be better. Actually, no, you shouldn't do that. So taking the recommended dose for that age, for your weight.
Okay.
And if that doesn't work, then it is maybe going to get allergy tested, going to see your doctor, see if there's something else we can do to help with those allergy symptoms.
Okay, so you don't have to needlessly suffer.
No, you do not have to needlessly suffer. But if you know, especially if you find that allergies are affecting your quality of life, you're not sleeping as well, you're avoiding certain situations, it's affecting your relationships, just your overall functioning, your school, your job, your work, you're missing days, then I would say do something about it. Try something over the counter, talk to your pharmacist, and if that doesn't work, then definitely make an appointment to be evaluated by your physician.
Okay, well, Dr. Ranchero, thanks for coming on, being well for the first time. I hope we'll have you back again soon.
Definitely. Thank you very much.
Thanks.
Okay.